Welcome back to our channel. Okay, so today we are going to discuss about OET letter writing paragraphing techniques. Okay, so recently in previous classes what we discussed is how to write an introduction of OET letter. So in that class we discussed how you can read the case note and identify the main purpose of the letter along with the key details of the patient as well as whether the letter is urgent or not or presenting complaint of the patient. If you know these four details, so you can write an introduction from that. That's we discussed in the first class, that is available in this YouTube channel and in our blog, that is oet4u.blogspot.com. You can go and see that one if you want to watch it. Okay, all right. So and in the second class we discussed about how we can find out from this case note what relevant, irrelevant and semi-relevant informations. That means how to categorize the informations in your case note. Okay, so today we are going to discuss about again letter writing with how we are going to write a paragraph. So the paragraphing techniques are different. So we are going to see how to prioritize the case notes in your actual examination question, and as well as with other methods like SPAR and other structuring methods. Okay, before going to do that, we're going to do an presentation same like what we done yesterday. So because understanding of relevant, semi-relevant and irrelevant information is very important while writing your letter. So let's see a case note first. Okay, so this case note is readily available in oet4u.blogspot.com and you can see that so what we are going to do is, so we are going to find out which is the relevant case note or irrelevant case note or semi-relevant case note. Okay, so it is, we are going to categorize this information. I better do in three different colors. I will choose for green for relevance and red for irrelevant and some other colors, maybe yellow for um, semi-relevant information. So we already discussed in the previous class that how we can identify relevant information. That means the relevancy is desiring if that is very much related to the present condition of the patient, presenting complaint of the patient, as well as in the context to which reader or to whom you are writing your letter. So for that you have to identify to whom you are writing in the beginning itself. Then only you can find out whether the information in the case note is relevant according to that reader. Okay, so let's see. As soon as you got the question paper or the case note, you're going to look at to whom you are writing. You can usually see that at the end of the case note in the writing task. Okay, you can see that writing task. Okay, so using the information provided in the case notes, write a letter to Dr. Susan Harper, a neurologist at City Neurology Clinic, requesting urgent assessment and further management of Mr. Wilson. Okay, so right, so we are writing to Dr. Susan Harper, a neurologist. Okay, we are writing to a neurologist. So we just made it clear that we are writing to a neurologist. Okay, then we have to find out what is the presenting complaint. For that you have to start reading from the beginning of the case note. Okay, patient details that is given, so that we know that that is important to write your introduction itself. Age, that is all the key factors related to the patient. Again, address, that is not that much relevant. If needed you can write it at the end of the letter. Okay, so the presenting complaint: brought to the emergency department today by his daughter due to increasing confusion and agitation over the past 2 days. From this sentence, you can find out what is the presenting complaint, or then you can relate all the information to this presenting complaint and check it whether it is relevant or irrelevant or semi-relevant information. Okay, so let's see the next sentence, that is reports of occasional headaches and dizziness for the past week. So occasional headaches, that is much related to confusion and agitation. There is a connection between headaches and dizziness, and this headaches is always a question for the neurologist as well. So this information, this note is relevant according to our categorization criteria. Okay, again, no history of falls or head trauma. Yes, because some of the neurologists will ask, because is there any falls for this patient recently, so we can put it as a relevant or semi-relevant according to whom you are writing. So here in this case we are writing to a neurologist, so you can put that into the relevant case note. So you can put it as a relevant case note. Okay, so we mark it as a green color. Okay, again, moving forward, medical history. Hypertension diagnosed 10 years ago, or and patient is on amlodipine 5 milligram daily. So you have to check it whether this information given in the case note, only this complete information that we seeing now, is it related to the present condition or is it important to the reader? According to me, it is important to the neurologist, because we are talking about hypertension and patient is having headache, so we will say there is a high chance and probability which is related to hypertension as well. Okay, so next sentence, again you have to do this process until you finish it. That is what we are going to do, because categorization of information in the case note is the second step you're going to do. So you can see that type 2 diabetes mellitus. Okay, you can see that is a past medical history, and you can put it as semi-relevant information. We can say yeah, make it as an yellow, because I think it's very very light color. I can't see that. I can put it in another color, like orange maybe. Okay, so let's see, that's a semi-relevant information. So no known allergies, is that a relevant information for a neurologist? It doesn't, because it's not that much important and not related to the present condition of the patient. You can say it as an irrelevant information. Okay, social history, lives alone, daughter visits weekly. I don't think that is that much relevant to a neurologist as well as to the present uh, condition, so I can put it as a irrelevant information. Smoker, I may say that's history of social history, maybe have some relevance, so I'll put it as a semi-relevant information. So we discussed yesterday in the last class, that is, so semi-relevant informations can give sometimes clarity to the letter. So that's why you can decide upon that later, that whether it is important to write a letter to the reader to give you clarity or not. Okay, and moving forward, examination findings. Blood pressure, yes, because we talked about already hypertension, so you can say that is an abnormal blood pressure, so we can put it as relevant information. And heart rate 78 yeah, beats per minute. Do you think, because it is most of the things are normal, that we discuss what are the things gonna be irrelevant? This is kind of an irrelevant information, so you can omit that. So temperature, bit of abnormal, I will say maybe I can put it as a semi-relevant information. Go for it. So you have to do the exercise until you find out all of the information in the case notes in this color. Again, neurological examination. Yes, neurological examination because you're writing to a neurologist, so that is relevant information. Blood glucose level. Yes, we already said that there is a diabetics for the patient, so we can say that as semi-relevant information. So, suspected hypertensive encephalopathy or possible metabolic cause of confusion is the impression. So, you can mention that what's your finding to the reader. So, that is also a kind of relevant information you can say. So, what is the plan of action or the treatment plan is admit for observation and further investigation, blood test. So blood test has been done. You can inform all of these as in relevant information. Now you finish with your categorization. Let's see what we are going to discuss today with this information. Okay, so this is about how to categorize your information in the case note. So now we can see what we are going to discuss about today and how to paragraph and prioritize your paragraphs. Okay, let's see. Okay, understanding prioritization. So, prioritization in paragraphing. Okay, that's very important because we already categorize the information. Now you have to organize that information based on relevancy and urgency. Now you can see why we done step 2 to categorize the information. So based on relevance and urgency, you can prioritize which information you have to write first and then move on. Okay, the most critical details should come first. Use clinical relevance to guide structure. For example, Mr. Smith had a flu last year. Okay, currently he has severe chest pain and high blood pressure. Mr. Smith is experiencing severe chest pain and high blood pressure. Last year he had the flu. See, in the first sentence, you can see the flu in last year is not that much important according to clinical relevance because he has severe chest pain. According to urgency, we say chest pain is bit more important than the flu which he had a flu last year. That is a past medical history, and currently he has got high blood pressure. So these two important informations you can write in the first instead of writing the flu. So the correct sentence should be Mr. Smith is experiencing severe chest pain and high blood pressure. Last year he had the flu. Okay. So moving forward for S-bar method. Most of you heard about this. What is S-bar method for paragraphing? S-bar is an abbreviation form for situation, background, assessment and recommendation. So this is the actual hand towering techniques we uses. Okay, so situation is we talk about the main issue reason for referral first. Then we talk about the background, like what is the past medical history or relevant past details that is very much related to the main issue. Okay, then we talk about assessment, current condition of the patient, examination findings. Then we say the recommendation, what the recipient should do next. So for an example, you can say, okay, so first one, Mr. John Doe, a 65-year-old male, presents with worsening breathlessness. That is the situation. Patient situation is worsening breathlessness. Okay, so what is the background? Patient had a history of COPD and hypertension. No known allergies. You can omit that information because still the background says history of COPD and hypertension. What is the assessment? On assessment or investigations, you can find that respiratory rate increased, low oxygen saturation and wheezing heart. And again, as recommendation, you can see the recommend urgent review and possible hospital admission. So this is an example. So this is the way you have to give a presentation to or prioritize information to include in a paragraph. Okay. All right. Other structuring methods. Let's see what are the other structuring methods, like chronological order. Present information from past to present, useful for progressive conditions. Sometimes you see case notes with some of the patients worst came like in past time, like in 2000, with and coming with a worsening of symptoms, like say about diabetics. The diabetic then it make into diabetic foot ulcer or something like that. So then diabetic neuropathy. The progression of the disease from past to present is chronological order. We will see an example soon in the next slide. But before that, we're going to move on to the next method, like problem solution method. Introduce the problem, then explain actions taken and required recommendation. Again, we will see what is problem solution method in the next slide. Okay, so SOAP method is subjective compliance, objective findings assessment, and plan of treatment method. This is, you can see most of the times case notes with the patient visits regularly, in different times, in like the first visit, second visit, and third visit, with subjective data. Patient gives some compliance, and you have to find out what is the you have to diagnose it, and then you have to find an assessment, and you will find a diagnosis, what is the prognosis, or what is the diagnosis of the patient, then you will treat. Then this is like a paragraphing method that you can use as well. Okay, let's see examples of this. Chronological order. As we said, Mr. Adams was diagnosed with diabetes in 2015, and she developed neuropathy in 2020 and now requires food care intervention. So you can see that progression from 2015 to 2020, from diabetes to neuropathy and then to food care interventions. This is a classical example of chronological order. Okay, so example for problem solution method. This is that what we said, that problem, there should be a problem, like you can say Mr. Brown has uncontrolled hypertension. Then for that problem, that is the problem, that uncontrolled hypertension is the problem. Then he was started on medication and requires regular monitoring. That is the solution, isn't? So that is the solution, isn't it? So one thing I didn't like, the problem first, then we are suggesting or started already something and suggesting a solution for the problem. This is also a method to write paragraph. Okay, then move on to SOAP method, that we already told: subject, objective, then again assessment and plan. Okay, for subjective, Miss Lee reports persistent headaches for 2 weeks. The patient complaining about persistent headaches for last 2 weeks. So what the objective, that means what is the investigation you have done? You check the patient's blood pressure and got a reading that is 140/90 mmHg. Blood pressure reading was there, and done an MRI for investigation, then vision intact. Then what is the assessment? There is a, means your probable diagnosis may be possible tension, headaches. Then you recommended lifestyle modifications and analgesics. So these are some methods that you can use in your OET writing paragraph structuring. Okay, so the key tip is, whatever the methods you use, or whichever the method you use, ensure a logical flow and concise structure. Always remember, your categorization of the information is important to prioritize, and then you can use the methods like SBAR, or problem solution method, or chronological method, or an SOAP method. So these are the methods you can use to write your paragraph in a structured manner. Okay, I hope you understand what we discussed today, and thank you for your support, and please subscribe for more videos, and please share my channel. Thank you for watching OET4U.